Trump administration saying it has fired the director of the CDC, but attorneys for the director, Susan Monarez, saying she's being targeted for refusing to, quote, rubber stamp unscientific directives. Joining us right now is former Obama administration health policy director, Dr. Kavita Patel. She's a primary care physician, also an NBC News and MSNBC contributor. Good morning to you. You know, we keep having these scenarios where somebody's getting fired by the administration and then saying that they're being unjustly fired. I'm curious, as you're watching this out, because this is playing out in your world, what's your initial impression, and what do you think has to happen before we even get into the implications of all of this?
Yeah, I do think that, Andrew, there are a couple of things to keep in mind. This is actually a pretty historic CDC director because it's the first ever Senate-confirmed CDC director. Previously, didn't require Senate confirmations. It didn't have to go through that process. That means that she got support from Republican senators, had to do the testimonials in front of Congress, the whole 9 yards, which is just an additional hurdle, but also creates a little bit, I think, of what came as a groundswell of support from both the public health community and bipartisan politics, which is not necessarily easy to do. So I do think that that's important for the context. That, and keep in mind that we've got August 8th, the tragedy that struck the CDC on her watch, meaning not her fault, obviously, but certainly something she had to deal with just weeks into her tenure, a shooting at the Atlanta campus that's still resonating and reverberating for the staff. So I do think that backdrop, Andrew, is important because it's a unicorn event, these things that could only happen on top of what you just mentioned about other Trump officials.
Dr. Patel, let's talk then about the implications as you see them from a health perspective. Obviously, we're walking into the fall. Lots of folks hopefully taking the flu vaccine. I know there's a question about taking the COVID vaccine and everything else.
Right. Yeah. So let's talk about the public health implications. Yesterday was also significant, and obviously these are not coincidences, but yesterday we saw the FDA change the label on the COVID vaccine to be pretty restrictive, to basically say that if you're not 65 or older, you must have a high-risk condition. How that gets enforced, what happens on the ground in my clinic and in pharmacies, that's, I think, left up to all of us. But the CDC is going to bring their advisory committee, which was, by the way, mostly 99% replaced by RFK Jr., by the secretary. They're going to meet in September, which is actually unusual to be so late because guess what? We're already seeing a spike in COVID cases, and we're seeing the season hitting us as we would expect, a respiratory season that's hitting us right now. So implications are confusion, people not understanding what and exactly what they should receive. Meanwhile, you've got major and prominent medical organization, American Academy of Pediatrics, American College of Obstetrics and Gynecology, and others that I assume will follow quickly, making different recommendations than what's come out from the FDA label and what stands as CDC language today. So that'll create confusion when you're walking into your retail pharmacist or into your doctor's office, and we'll have to.
Well, that's my question to you, which is what do you recommend to those who are watching right now as it relates to these issues? And also, I was actually speaking to a doctor about this a couple months ago when we were talking just about CDC language and everything else, about whether it creates any kind of liability for doctors who ultimately recommend against what the government recommends.
Right. So let me handle the first one first. What's happening right now? So I am telling patients what we have today. Most of us in our clinics are waiting for the new shipment of the revised COVID vaccine. And we haven't gotten, Andrew, in the DMV, the Maryland area, we haven't gotten our updated flu shots yet. So we're waiting for those. We're on order and we should get them imminently. But you can walk into a retail pharmacy if they have the supply and get the older version of the COVID vaccine. I know that there are a lot of people, myself included, traveling, school starting. We just want to take that precaution. I think that's completely reasonable to go ahead and do. And then what I'll say is that because of this FDA label changes, that September CDC meeting, there could be an insurance change where you might not have coverage. Medicare and Medicaid usually follow immediately following that September meeting, but most private insurers will change coverage, if they do, in January 1st of 26. So you do have these months to wait for the updated vaccine. So I've given people a couple of choices. Flu shots, I resoundingly recommend. And then we've got RSV season. I want to make sure that people eligible for that, 50 and up, also get the RSV shot if they can be eligible, and the pneumonia shot. So that's a lot of shots, Andrew, but we have to kind of walk through that for people. Second, to your liability point, that's just blatantly not true. I've got malpractice coverage. This is something that their implication was that if we go off label from what the FDA has and that we recommend a vaccine, that somehow we will have this immediate trigger or potential trigger on liability. I think as long as you go through the informed consent, which is what all of us do for vaccines, should be doing, that we do not have to worry about that liability coverage. What does come up for liability, though, and it hasn't been spoken about, is a little bit of a different permutation. There's a vaccine injury coverage protection program put in by the federal government for vaccine injuries. There's a chance that may not cover you if you receive the vaccine outside or off-label from FDA, CDC guidance. So there are serious implications here, and I don't want to minimize them. But there's more confusion about everything from the top, because if you go to a government website, I'm not sure that you can trust the clinical information they're recommending. And I think yesterday's departure of not just the CDC director, but other staff confirmed that.
So then how quickly do you think this void can be filled at the CDC? Senator Bill Cassidy, who is a Republican from Louisiana, said that CDC's high-level departures will require oversight by the Senate Health Committee that he runs. What do you think he means by that? And, you know, how unprecedented is that type of Senate oversight over the CDC?
Yeah, Leslie, so, you know, I'm getting old. My job before I worked in the Obama administration was a staff director for that very committee under Ted Kennedy. So I know exactly what the senator is talking about. We had oversight staff. We conducted oversight hearings. We conducted investigations on an ongoing basis. That's what he's referencing. I think that is the bare minimum. Let me just say, I can authoritatively tell you that that's the bare minimum of what a committee can do. A committee can actually advance, and because this is a Senate confirmed position, a committee can actually advance, and the senator himself could advance a slate of nominees. We did that on a regular basis. The White House doesn't have to take them up, but putting out a daily call for replacements, giving names, asking for answers, not just through oversight hearings, but you could imagine having actual daily roundtables. Doesn't even need to be hearings, roundtables. I just want to point out that RFK Jr., the secretary, is due to testify in front of the Senate Finance Committee September 4th. We'll see if that happens. That might be the first chance that we get to kind of hear from the administration about this.